Okay, I'm Alfred Beauvais, and with me today is Dr. Deepak Bhatt, who's a professor of medicine at the Harvard Medical School. Dr. Bhatt was involved with a trial called REACH. And so, Deepak, thanks for the conversation. Tell us about REACH and what we can conclude from it.
Sure. So you're right, Gabriel Steg and I co-chair this registry. It's not a trial, but a registry of 60,000 patients or so from around the world that were followed for 4 years. And there have been a number of observations and publications out of the registry, over 50 papers. What was presented today at the European Society of Cardiology by Dr. Dharam Kambani, who's at the University of Texas Southwestern, was what I think is an interesting analysis of patients from the REACH registry with peripheral artery disease diagnosed, and then an examination of what the impact of being on a statin versus not being on a statin was. Now, you might ask, why weren't these patients on statins? At least during the time of this registry, not every PAD patient was being treated with statins. And in fact, even in 2013, undertreatment of PAD is a problem. But in this cohort of PAD patients then, some were on a statin, some were not on a statin, and outcomes were examined. And for cardiovascular outcomes, as is already well known, from randomized data, there was a significant reduction in myocardial infarction, cardiovascular death, stroke, that sort of thing. But what was interesting, I think, and incremental in this analysis was an associated reduction in the rate of peripheral ischemic events, including things like amputation. And while not randomized, it at least is supportive data that while we're giving statins, hopefully to PAD patients to prevent heart attack, we might even be preventing amputation.
Yeah, so I think one would, at least in the world we're in right now, intuitively guess that you would get this kind of effect. Trying to do a clinical trial against placebo in peripheral arterial disease is tough now because we know we're compromising the cardiac benefits of statins. So I think we have an important registry observation that tells us we should be gaining significant value by the use of statins in patients with PAD, regardless of whether they have evidence of cardiac disease at the time.
Absolutely. I think this gives the doctor yet another good reason to prescribe statins in patients with PAD.